asked me, some of you have asked about who will be doing his job once he leaves. We think we know how that's all going to play out, but before he leaves, you'll get a notification and you'll get email addresses and phone numbers and so forth, so you know. I don't want to let the cat out of the bag too soon and then something change at the last minute and everybody's confused. So just keep that in mind. I'm also going to pass out, and we'll touch on this very briefly because not much has changed, a copy of the sewage fees. This is draft. Again, this is draft. So there's a few things on there that'll be...
They're going down?
They're staying the same.
Yeah, right.
They're staying the same. We did have to add a few things because the code talked about some things we didn't have before. But we'll get there.
Wages.
All right, first, before I fail to do this, I mentioned earlier that there is a new code that's been adopted and it'll become effective January 1st. So you want to make sure that you know what's going on. And those are some dates and times of different training that are going to be going on. So you can jot those down if you want to take advantage of any of those. October 14th, up in Paynesville, if you want to drive that far, Ohio Environmental Health Association is putting on something with Ohio Department of Health. So you can take advantage of that October 14th. November 21st, we're going to have our next installer meeting here. Now I'm going to tell you, we only have 3-hour sessions, so I'm going to give you the Cliff Notes version. I'm not going to give you the long version. If you want the long version, attend this one, November 24th. Ohio Department of Health is going to be up at Summit County Health Department from 9 to 3. So if you're ready for a long day, they're going to have that up there. They're going to go over the code changes, probably in much more detail than I will, November 21st. If anybody else is interested and doesn't mind to drive farther, if that date's a conflict, there's another one going to be held in Mansfield and another one in Muskingum County. This is about the closest I can tell you around here is Mansfield, Muskingum County. If you want those dates, if those don't work for you, I have a few more dates that you can get if you want to go to the Ohio Department of Health training. And by the way, any of those will count as CEUs, but that may not matter. I'll get to that in a minute. So, some dates to keep in mind. A couple other things that we've changed recently, we want to make sure, once again, reiterate and people are aware, is if you are a designer or an installer submitting plans to the health department, please send them to plan copy. You can send it to the sanitarian, but CC it to plan submittal at starkhealth.org. What is happening there is the clerical staff is getting the fact that you submitted a plan and logging the address, so we're keeping on task with plans getting reviewed. And we're doing this not just with plans, we're doing with everything we're doing in sewage. So as the stuff comes in, they log it, and then I track it, make sure I can pull out, about every week I pull out what's outstanding, what needs to be done, and it's my job to get after somebody to make sure it's being done if it hasn't been already. So that's why we're having you do that. We're hopefully making it easy on you. Just CC it to that. That's the end of your responsibility, and then we'll take it from there.
Can we do the same thing for voicemails about being returned?
Kathy might wring everybody's neck. No, that's just for plans, please. Anyway, that's the tracking mechanism we're using there to make sure things are being followed up on a timely manner. I do want to tell you that, technically we do have a 5-day turnaround. We try not to do that. However, when we get as busy as we've been, sometimes it does happen. So we try to get things done in 3 days, particularly for replacement systems. Sometimes the new construction might linger a little longer because there's just so much going on right now. So also what we're trying to attempt to do is when the sanitarian reviews your plan, that you get an email back saying your plan is reviewed and these are the last few things I might need. For example, if it's new construction, maybe it's house plans or it's signatures or it's something like that. So you know what's needed so that that permit can be obtained. That same email you'll probably see has been CC'd in our office to plan submittal. So Kathy knows plan came in, plan got reviewed, and here's the last things I need before I can issue the permit. So that's the tracking mechanism we just got moving. And that's why we also, when you signed in today, we want your email addresses. As best we can, we want to try to do business with you via email. It keeps you up to date quicker. Possibly if you even have a smartphone in the field, you can see things as they happen on your phone if you're using that. Those of you who still use fax, we can do that, but it just takes that much longer. So might want to buy a computer. All right, so just remember those few things that we're doing different there. Jason mentioned that we are scanning the documents. I just want to mention a little more about that. So when you go downstairs, they're gone. All of them are gone. And you can't come to the counter and request that without it taking some time. So what happens is when we get a request from you, unless it's already in the database, so I'm not sure where we may be at 30, 40% that's been uploaded now. But when you come in, we contact that company that has that's doing the work for us, and we say, will you please email us such and such a record? So they have all our records. We take at least a day turnaround because they have and we have to request them. When it's all said and done, you will have access to the permits. And here's the thing. This is the thing we struggled with. We could have put them all together, but the problem is some of that information downstairs has health information, social security numbers in it, for various variances we've done over the years. For sometimes we get a request from a doctor saying so-and-so has Giardia, I need their water tested. That stuff is in those files. General public can't see health protected information. So we had to make the decision to split the file in half, gave public access to the permit section so you all can get it, your homeowners can get it, but the rest of the stuff we had to keep back into a separate file. You can still get copies if you need it, but you'll have to call or email and request anything that's not a permit. That includes nuisances, because even some nuisances have health information in them. So we have to kind of go through there and make sure nothing's there that I can't release to the public.
So we would download the as-built and you'll tell us if they're oversized or not, or they just all be uniform 8.5 by 11 and be split?
The way it's supposed to work, Paul, and I know there's already been some flaws. You know, think of it this way. I sent these documents to a company that doesn't know what sewage records look like. I had to give them copies of all the vintages of permits that we've done since 1950 and 60 and 70, and said, this is what they look like, make sure you scan this into this file, and that the rest goes over here. So what they're supposed to be doing is a copy of the front of the permit and the back. And on the newer ones, a copy of the permit, the worksheet, and the picture. I've already seen some errors, and I was expecting some amount of errors. So we've been trying to make them correct it, but at the end of the day, we may have to do some correcting on our own to try to get stuff over there that's not there already. Yeah, Jay?
They're also scanning in like previous inspection reports.
Everything. Everything in that. In fact, you're going to see sticky notes and those old pink slips. They're all getting scanned. Anything that's in there, they've scanned everything. So and that's, you know, they don't know sometimes what to remove, so they just put everything in. So in the future, if you, for whatever reason, suspect that there's a record missing, it's very possible because the company is, you know, again, they're not well versed in this. Just call, just email, we'll get you the other half out to you that we have access to, because it's in one of the other locations.
So we need to be very specific when we request files now? I mean,
You should be
detail
specific. You should be specific. I want to know, because we don't want everything that's in that file. I want to know if there's a nuisance there. I want to know if there's another sewage record that for whatever reason isn't in the wrong spot, something like that. Yeah, Bob, do you have something?
So when this is all said and done,
Yeah.
we'll go in township, address, and it should take us
Actually,
right
it's
there.
even simpler than that. It's going to go by street number and street name. In fact, probably what you'll do is just put the street number in. Because the name could have, see, the other thing they did is they did not go through and correct address spellings. They didn't correct any of that. Whatever that file card that you saw down there said, that's what went in. So if they were misspelled or they have East Maple or Maple East, that's the way it went in. But if you put the number in, the number's usually right, and you'll see East Maple, Maple East, and you might have 5 roads with the same number, but that's easy to pick from, 5 roads. You just say, oh, that's the one I'm after. You pick it, and then you can download the permit, a copy of the drawing, and hopefully most of the right information is there. None of the soils information is going in there, it's just the permit and the drawing, and possibly the worksheets.
As-built.
As-bills. And we had to really get after them on as-bills, because over the years, we used to do them back to the permit, and they were loose leaf in the fold. So, again, you think of a guy who doesn't know what they're looking at and try to tell them how to separate that file. So we're hoping that maybe at least 75% of it's good for you, and you can use it, that'll save us 75% of your phone calls. The last 25 we know we're just going to have to deal with and get that stuff out to you. I don't even want to attempt it.
Okay, that's fine.
I'm not hooked up to
I was
that.
just wondering.
But basically, what you'll be given, everybody in the general public will be given an access name and password. It'll probably be something like public. Just type that in, and then you'll get in there and access whatever record you're after. So those of you who are pumpers, this is nice.
Sure.
You can just get in there, hey, I can find the tank, there it is. You can do it from your smartphone if you have one. So anyway, that's what's going on. We're thinking about a month left. Public portal will be coming after that. It'll probably be a link on our sewage page and our water well page on our website. If you want to get a downloaded record, you click there and it'll take you over to this website to be able to view the record. And again, please keep in mind, though, I'm going to throw the caveat out there. It may not have everything you're after. It was the best we could do given what we had. Yeah?
It's not gonna have the O&M data, right?
No, it doesn't have that. No. Nope. And we keep that at a different location. So all those records down there didn't have that. Most of them didn't have it. Unless there was an issue and we requested it from somebody. Okay, I want to make you aware of a few things that will be happening with the new rules that you'll probably want to know sooner than later. I'm the messenger. Please don't shoot me. They are requiring testing. Again. I know. Again. 07, if anybody was in business in 07, you remember that. They did the testing, then they rescinded it, and now we're back in, we're having to retest. They told us in the conference call the other day they're going to try to get it so that it's an online test. I hope that's what they do because that'll make life simple for you and me. So as of right now, the options we're aware of that they're working on is an online test. You can go down to OTCO, and some local health departments might proctor that as well. So keep in mind, probably before you re-register in January, you're looking at a test for installers, haulers, and service providers. I understood it was something like a 30-question test with maybe 10 questions in each subject that you're licensing and beyond the general. Sorry about that. I wish we didn't have to do that. Statewide bond, on the good side, is they are now looking at, they are instituting a statewide bond. I've said this a few times in the past. It's coming forward. So if you get a bond, it's good for anywhere in the state. So you don't have to go to every county and present a different bond. The bond amount has gone up a little bit. $40,000 for an installer, $25,000 for a service provider. And then also, if you are a multiple registered person, service provider and installer, they reduce the amount of the service provider bond to $15,000. So you can present a 15 instead of a 25 if you have multiple registrations.
But some people may encounter on that, to get a state bond is a lot tougher than to get a
Is that
local
right?
county
Okay.
bond.
And I didn't know
It
that.
it may cause some people, and it, depends on credit ratings and things of that nature, it may cause some grief.
Difficult? Okay. No, keep that in mind, I didn't know that. Did I see another hand? Okay. The bond forms, my understanding is the bond forms will be provided by Ohio Department of Health, so you should be able to have those access to those hopefully soon, so you can get started with that. Steve?
The last time the state bonded us,
Yeah.
and then we didn't get that money back when they rescinded the rule.
I
We
know.
had to turn around and rebond.
Yes, I remember all of that. Yes, and that was a pain for all of us, but that's what happened when the code got rescinded.
So
Yeah, it
actually,
made a
we're gonna
mess.
take these paperworks and go to our regular bonding customers, not the state.
Well, you'll have the state bond form, and then you'll present that to your bond, because it'll say about anywhere in the
You take
state.
it back to your insurance company that
Yes.
you now have your bond for, and get that filled out.
Yes, yes.
This test has to be taken before January 15th? Or-
January 1st, 2015, if you're going to re-register. Because when you take your information in to register you, well, it'll have to be in the information. Yeah. Okay.
And this is online now?
It is not online now. I just heard this from a teleconference I heard just the other day, or at least was reported to me, that they were trying to get it online.
So it's a mad rush like it was the
It'll
last
be a
time.
mad rush like it was.
Right.
I mean, we had to have the book and where we find it.
You can now download the rules off of Ohio Department of Health's website. So if you want to copy those rules, they're there. So if you want to get them and start reading them, that's the first thing you can do. Or attend one of the conferences and you're going to get the you know, all
So
that.
that's where the 12th or the 21st comes in?
The 21st here, I'm just going to give you the Cliff Notes version. I'm not going to give you the whole deal. And those other ones, they're from 9 to 3. Yeah, you don't want to be here that long. 9 to 3 at those other places if you want to get the longer version. So, I'm just on this 6 CEU thing. So here's the deal. I got to cut you loose on any CEU requirements because you're going to retest, and I can't say you've got to have these CEUs before we register. I can't do that until 2016. So if you don't want to show up again, have at it. That's your choice. I can't tell you to do that, but you may want to if you want to know what you're supposed to be doing next year. That's up to you.
Is our class 1 still good for the CUs and everything else? Or we have to-
Well, I don't know.
Okay.
I don't know. They give you some choices in the code about joining certain organizations, and they're going to keep you up to date, or you just obtain them like you are now. You go to this health department or that location, and then they honor it. So I'm not sure how all of that will play out. Maybe if you have a Class 1 operator's license, I'm not sure how they'll consider that for CEUs. I don't know.
I gotta do that every year, I mean,
Yeah.
we gotta have
Right.
12 anyhow every 2, so.
Right. So 6 CEUs needed for 2016 because you get to take a test this year. And this is the one that some of you are going to cringe on, okay? If you have late as-bills, I can't and I won't register you. Get them in. Because after 2015, all the paperwork has to be turned in. It should have been turned in when it was done, but they give you a year. And when you're done, you got to have it all in, or else we can say, you don't have all the paperwork in. So, I mean, what happens is these files just sit and linger, and we just can't keep them moving like we should. So please keep that in mind, that if we have, what we'll probably be doing is I'll talk with the sanitarians if they have a certain installers that they don't have drawings from. You'll be given notice, or at least an email saying, I need, hopefully not more than 5, drawings from you before we can re-register you. So that's going to be important for some people. Yeah.
Some county health departments require that they do the inspections. Will the statewide then allow us to be?
That's a good question. The way I'm going to say the way I've interpreted it, it says that the local board of health has to allow a service provider to conduct an inspection in lieu of the board of health doing it. Now, how they're going to interpret and run with that, I don't know exactly. We already do that. And I know some don't, but that there's a provision in there. In fact, I think I'll be getting to it, so just hold on just a moment, we'll see what happens here. Here it is. Okay, so I'm going to start getting into the O&M regulations that I passed out. Many of you took a copy of. I wanted to make you aware that the current O&M regulations that are in our code book will be voided here shortly because of the passage of state rules. So we had to turn around and re-adopt regulations, so on January 1st we don't lose any of the stuff we're doing and try to keep things flowing right. Much of that's been just simply reworded, but there are a few changes I'm going to get to. So the Board of Health, they say, shall adopt operation and maintenance program and have the plan like we talked about earlier. But in there's a requirement that says if you have a pre-existing O&M program, that's fine, provided you allow service providers to report to you instead of you going out and doing it yourself. That's what it says. So how that gets interpreted, I know how I interpret it. So we'll see. Now that, again, doesn't preclude the Board of Health from making sure service providers are doing their job and they're reporting accurately. So if you have a copy of those regulations, I'm just going to go through the highlights of what has changed. Though it's worded differently, it pretty much creates the same O&M program that you all are accustomed to right now. But I want to point out a few things that we did change or modify. We did reformat them. Some things were reworded because I realized that there were some clarity problems in there. Some sections were added basically just that reiterate the state code. So you'll see sections that probably, if you read the code and compare them, you're going to see the same wording in there. And that, again, just was to keep consistency. Pardon me. This thing's going to keep beeping unless I look. Okay. Okay. The other things were just simply, I believe, minor changes, and we can answer any questions on those. We did add just a simple definition section because we use the same terminology that the state's using, so we're referencing the state's definition section. So we're on the same page. For example, there's three words I want to make sure you're clear on because it makes a difference. There's STS, HSTS, and SFOSTS. What's that mean? Sewage treatment system is all the spectrum of sewage treatment systems, home sewage and these small commercial systems we do. When you see STS, that means both of them. When you see HSTS, that means residential, single and 2 and 3 family dwellings. That's HSTS. When you see the other term, SFOSTS, that's small flow on-site sewage treatment systems. Those are small commercial systems that we regulate under 1,000 gallons per day, non-discharging. So when you read that code, you're going to see sometimes those terms being used, and I want to make sure you know that's one of the terms that will be defined in the state rules, that it will separate things that are done differently for those types of systems. Small flow, and this goes to the question that was asked by Mike earlier. A small flow operator, right now they have to get a yearly, this is the only one type of system that has to get a yearly operation permit with us. But if they, in doing their yearly operation permit, they show they have a contract with a service provider, the fee, you'll be collecting that fee like you normally do, but there is no fee from us when they do that. And that was to align with state rules, allowing that small flow operator to have you out instead of us.
Does it still require a property transfer?
Yes, because the definition uses STS. That means both types, so it does, they do, yeah. So anyway, that's just to line ourselves up with the fact that they're allowing you guys to do those inspections instead of us only. The other type of system that was added to the list of systems that need service, you're already familiar with aeration, drip, spray is also included there that need to have a service contract. Also this new Type 4 gray water system. I've never seen one. I know you've never seen one. But the idea behind a Type 4 gray water, it has to have a service contract. The idea is you can surface supply this gray water provided it's got some pre-treatment going on. It's not NSF standard 40 treatment. It's a different kind of treatment. I'm not familiar with it. I think it's NSF 350. I don't know that standard. But anyway, because there's pre-treatment going on with this gray water system, that's been added to those that need a service contract. And again, what we did here is we had to align ourselves with the state rules to make sure that we were doing what they told us we had to do. We have to have permit terms. So those permit terms you see there, 5 and 10 years have been established in that draft regulation. A couple things we did. We added that we're simply what we were doing by policy, and we wanted to add those so that we were clear on that. One of those is the service provider shall affix the sticker, the audit sticker that you guys are already doing. We've done it by policy, but now it's in there in the regulation. This next one is, again, we try to find out what the state was going to do with homeowner service providing. And because they figured it out, we've added the fee, the $30 fee for registration with us as a homeowner service provider, which aligns itself with what you're paying for their service contract. So everybody's paying the same fee, whether they're a homeowner or whether they're getting it through you. This next one you guys probably never see, but there is an exemption in the building code that allows a person building a detached structure less than 120 square feet to not have to have a building permit, and also we made it so you don't have to have a septic review when that happens. That's pretty much done through us, but it's in there for clarification. We also put in there conditions for postponing the property transfer inspection. That's been done on a waiver form, but now it spells it out in the rule that we permit that, and the waiver form is the same idea. It's the same thing's being done as it was in the past, but it's been cleared up. The next one is the code said you had 30 days to connect to an available sewer on a property transfer if it was found that you had access. We made that 60 because that's what we've basically been doing in-house is 60 days to allow that time for closing and then allow for people to get themselves situated. Also, the next one, again, not something you guys normally see, but whenever there's a property split that takes place, the Regional Planning Commission requires that the septic at that location be reviewed to make sure it's not crossing property lines, make sure it's operating properly. We just aligned ourselves with what they are already saying for regional plan. The last thing is, no matter if there's certain exemptions spelled out in the O&M code, it doesn't preclude the Board of Health from having to still abate public health nuisances. So, for example, if I have a property that we have a nuisance on, it's been vacant for a while, and you go out there and inspect that property and say it's fine, well, it's fine because it's vacant, and I have an existing public health nuisance, that doesn't mean they don't have to fix it. That's what that last statement toward the end of your rules there clears up. Just because you pass doesn't mean that you still don't have to fix it. Yes, Renee?
I have a question
Yep.
about the service contracts. Some of the systems that are required to have them.
Yeah.
Are you saying that a mound system with septic tanks does not have to have a service contract?
That is correct. And that's how it's been. Yeah.
Okay, and that's.
Don't you think it should?
Don't you think it should?
Yeah.
I think they should be reporting service. And a lot of this, guys, is manpower. I have to look at what I can do, what I can't do, and I can't do that. But this plan outlines a way that we're going to start pulling those in the future. They should be serviced, absolutely. But as of right now, they're not required to have a service contract. We'll see how that develops. Right now, we're at 70% on ATUs. We got to get that thing knocked out and move on to the next animal. But yes, they need service. The means in which that's done hasn't been fully ironed out. Okay, if you have a copy of that rule, you also see at the end of it kind of a strange place for it, because this is primarily operation and maintenance. But at the very end, you'll see establishment of vertical separation distance to seasonal water. We had put somewhere, it was either create a whole nother resolution and get it lost, or stick it with this one. And what this does is the Ohio Department of Health says in their rules, the Board of Health can or may establish a vertical separation distance to seasonal water. And here's what kind of makes it difficult for you guys. You were hoping for this unified code that everybody can be the same. Well, every Board of Health may adopt a different number, which you know what that means. A different number means different technology and different techniques to deal with that number. This is probably the thing that caused the state rules to be rescinded in 2007. This is probably the biggest thing. So the state legislature said the Board of Health may adopt anywhere from 6 inches vertical separation distance to 18 inches for seasonal water. Not other stuff, not bedrock, not groundwater, seasonal water. So they gave us the authority to adopt a number, and that number has been spelled out here in this draft. We're going with 12 inches. 12 inches is actually what the state defaults to if you pick nothing. So 12 inches. What's that mean? Right now it's 24. Your system just got 12 inches closer to seasonal water. You know what that means. It means cheaper. It means more septic tanks. It means less aerobic systems. So less maintenance in many cases. So that's what that essentially does. It brings systems back into the ground more than it used to be. I see some head shaking. I want to clarify the head shake. Many of you who've been in business a while remember that the old code, basically what happened, though you may not have realized it, is we maintained about a 6-inch separation off that just by the way we specified systems. It was 24 for the last 7 years. Now it's at 12. It's somewhere in the middle from where it was. We have systems that operate very well at 6 inches, though I don't recommend it because it's probably not the best idea. 24 may have been a bit much, but that's what the state did in 07. So we're in the happy medium, I feel, as best as we can be for that. Letter B, the minimum separation also has to be established by the board for whenever you pre-treat, what is it, 1,000? To less than 1,000 colony-forming units of fecal coliform. Then the state law says you can establish anywhere from 0, means you can lay it right on top of the seasonal water, to 6 inches off the seasonal perch water. But you can't go any higher than 6. So we chose 6. We don't want you in it. So we're going to be at least 6 inches above the seasonal water if you choose to pre-treat. It's not just treatment, it's also trying to get that water out of there and not having it surface. So the draft says 6 inches for aerobic minimum separation, and it says 12 inches for septic tank effluent. That's what's being thrown out there. They also removed most, but not all of the requirements for equal distribution inside of that code. So for example, in '07, we were all having to do LPP, and we came with flood dose because we had no other practical ways of doing it. They took a lot of that out of there, so we're back to a lot of gravity distribution that we didn't have just as of right now. So I want to make sure that you'll know that that's happening. Is there any questions about vertical separation? Because there's a few more things I want to say about the draft code before we move on. Okay. A few more things I want to point out that are a technical thing that'll be coming out. Now again, I'm not going to cover all the code today, and we surely can't do it all in November. But a few things that I want you to kind of take note of because it makes a difference, just little technical things. Another thing is the code says that seasonal water, it will now be defined by 5% depletions. The old one said 2. 3 more percent in many cases makes a big difference, how you call that out. Soil scientist turns that into us. Right now, if he says 2 to 4%, bango, there's a seasonal water and you're shallow. It might put you down several more inches when they jump it to 5% that the code is doing right now. Another means of, they've brought the systems down a little bit in the ground, whereas right now, in many cases, we're out. So just one sentence did quite a bit on expense. Some of you have, probably many of you haven't, but some of you may have heard about the sewer connection whole fiasco that was going on. There was, for a week or two, discussion that they were going to change the rules to make it so that it was optional whether or not a person had to connect to a sanitary sewer if their system was working. Well, that's a bad idea for lots of reasons. So the state had a lot of pushback, and they kept that all out of there. So basically, the same sewer connection guidelines that are there today are what got into the rules. However, there are some legislators that are still trying to tinker with that rule because they don't like it. And there's probably some legitimate reasons. You know, when a private sanitary sewer gets extended, developer, here's where the existing sewer is. He's developing clear up here. He's putting subdivision. He's passing 10 houses to get there. Those people had no say in the extension of that sewer, and they got to connect. The legislature doesn't like that. So I get that. So that's some of the beef that's going on right now with sewer connections. So what it says today in that rule may get overturned by the legislature in a future law that trumps that requirement. But as of right now, it's staying the way it was.
So it's saying that if I do inspection, there's sewer available, they have to tie in?
They've got to tie in. I'm going to tell you, what you do is report that because there are some exceptions. And I don't want to go into all of those exceptions, but there are some. One, for example, is distance. If it's greater than 400 feet, by definition, that we maintain, it's not accessible.
Structure or property line?
Structure. Now, there's some exceptions. You find it failing, and it's 400 feet, you're going to connect. Okay,
so they got a good working system.
Yeah. That's just one exception. So let us go through there's other ones that I won't get into, but let us go through those and we'll try to hash that all out. Softeners. I'm just going to throw this out there. I'm not entirely sure what we're going to do with it. The code is permissive on softeners going into septic system. And for years, I've read articles back and forth about it. They say it's fine, and this guy says it's stupid, and it's fine, and it's stupid. So it's permissive. Unless the manufacturer of whatever treatment component says it can't go in. Now, unless I'm mistaken, I see a lot of aerobic people here today. Unless I'm mistaken, I don't know of any aerobic treatment unit that permits softeners to go in. Is that a correct statement? Okay.
Will make sense so you don't short circuit.
Right, for lots of reasons. So we're going to tell people at a minimum, you got an aerobic treatment system, forget it. Because the manufacturer says you can't do it. And it's still a bad idea for other reasons. So our permits may say it is all, but we have to get that all hashed out. But it is permissive as of right now.
It's permissible?
Permissive, unless the manufacturer says no, or unless the permit says no. So we'll see.
All your old permits said they weren't supposed to go there.
Yes, they did. Yes, they did.
Well, that's why they're going to revise.
Yeah. So probably what's going to happen is we're going to put the code won't not allow it. We have to not allow it. We have to say no.
So you're going to say no?
So we're probably going to say no, but I'm not the final authority on that law. So we'll probably say no.
Probably.
Probably. All right. The last thing I want to bring out that is going to be thrown into this code that we'll be able to tinker with is curtain drains. Curtain drains were removed in '07 primarily, but they're brought back in. Now here's the thing. There's two different kind of perimeter drains. One is a curtain drain and one is an engineered drain. A curtain drain can be installed to help the system, but it cannot be used to say I'm lowering the seasonal water table X inches so I can go deeper in the ground. It's just to augment the system's performance. Curtain drain. An engineered drain can claim lowering the seasonal water table so that perhaps if it's at 24 inches, we can sink a system a little deeper in the ground. But there's a difference. It's got to be engineered, of course. So that's where they came out on perimeter drainage on those.
They were talking at the last reading, they were gonna have models drawn up for all the different types of soils. Did they do that?
There are models on many soils, but I don't think all. I have a lot of the soils we have in this county, I've been able to reference that model.
So are we allowed to use that model for the design plans, or do we have to have using that licensed soil engineering?
Probably the model, but probably after the state gives us some interpretation on that. I don't want to say for sure, Paul, because I don't know until the state gives me a little more interpretation on that. But the models exist.
I know they were looking at them.
So the models tell you the spacing, the depth, and how much water it'll lower based on those factors. So, okay, so those are some other things I want to bring out. They're not on there, but what the state code is probably going to be doing. Little technical things make a big difference in the final cost of the homeowner. On the fee sheet you were passed out, all those fees are exactly the same, except we had to add 3 fees, and that is a permit for gray water recycling systems, because we don't have such a thing right now. So they're in there now. Permit for a small flow gray water recycling system. And then that last one there is the homeowner service provider registration, which I mentioned earlier. But you can keep this, except for those 3, those are the established fees are already operating under, so you can reference it if you need to. This will go before the board. First reading will be October, what is it, 8th? October 8th. But I want you to notice this. The fees will increase, but not because of the local board of health. The state health department is increasing fees in 16 and in 17. So every time I issue a permit, I got to tack on the state fee. You see it here right now is on some permits it's $25. That's what it's been for a long time. In 16, that permit will go up to $50. For new construction, it'll be a $50 fee from the state that I have to send it right down to the state health department. And then alterations will be 25. And then in 17, it'll be 74 and 35. That's written into the state code, so I have no choice in that matter. So you will see the fees go up, but not because our board of health has done it. Yeah.
Todd, why are the homeowner service provider fees not matching the ones that the professional service providers have to pay?
It is in that the contract you sell them is $30, and then this is $30. But it's not. We do a lot more business with you guys than we do with them.
But you probably have to babysit them more.
There is some of that goes on.
Yeah.
So no, I don't see, at the end of the day, Bob, I don't see our Board of Health adopting a $100 fee for that. It just ain't gonna happen. All right. So let me update you on another thing that's going on right now. And this is good for those of you that do property transfer inspections. It's good for you to know about. You don't have to study it, but at least know that it's happening. You see various areas on the county map here, and these are the areas that are currently under study. The sanitary engineer is working with NEFCO. Some of you know that agency. They're a planning agency, environmental planning agency, to study these various areas in the county that need sanitary sewer. And the problem is there's so many of them, and there's only so much money to spread across to try to get them fixed. So they want to prioritize which are the worst and which aren't quite as bad as we thought. So what they're going to be doing is doing some statistical information, number of houses, number of failures, also some sampling. So at the end of the day, this document will help us plan what areas probably need sewer before others. For your sake, this is information that you can think, you know what, I know they got some problems in those areas. So if you are in any of those areas doing inspections, I can guarantee you better watch what you're doing because there's problems. Some of them are very apparent. It's right there in the ditch. And some of them, for example, this one right here, Orland Estates,
Those travel a long way.
it's all down in deep storm sewers that goes the country mile till it discharges. So bear in mind what you're doing because some of this stuff goes a long ways before you ever see an outfall from it. So that's what's going on right now. Good information for you to have. Is there any questions so far? All right, spray irrigation. Once again, I know that there's mixed feelings about this, but it's out there. So I guess we're going to try to use it and use it properly. It is not the answer to all problems, we know that, but it may be the answer for some people whose lot and soils are limited. Basically, that's just a picture of the Director of Health signing off on this device to be used in the state of Ohio. It was approved in July 2014. So a couple things, if you are on a site as an installer, consultant, or designer consulting with a homeowner that I think you should probably bear in mind so you can decide whether or not this may be a viable solution for them or not, is number one, you have to have at least 6 inches of unsaturated soil to work with this system. That means cattail still won't work with spray irrigation. Now there are some systems that it will, some soils that it will work with, and 6 inches is not very restrictive on how much of that soil you have to have. So 6 inches of unsaturated soil, first and foremost. Got to avoid swales and natural drainage where the area of application is going to occur. So if you have a property that's dissected by swales every which direction, and drainage and ponds and creeks, you can't do it, or it's very difficult to do it. It's very difficult to do it. Slope. Is slope a limitation? Not really. It says that you can go up to 25% without any even safety concerns. So all they're saying here is you can apply above 25% as long as you consider safety as a factor in your design. So slope is not a huge limiting factor. Okay, now here's another one that'll be a very quick limitation to many properties. The application area has to be 50 feet from adjoining properties, from dwellings, from the house at that location. Hardscapes such as driveways, areas of food production. You know, I guess their garden. They don't want to put their garden in. So keep that in mind. Many times you're not going to have the space to install this with a 50-foot setback and then have an area to install these things. You should also, it talks about using low trajectory spray, and I have a couple pictures of what these things look like. But it's just a low trajectory, so you're not launching it up in the air. You know, a lot of you would drive back by farm country, maybe out the muck farms, you see that thing just launching itself. Not so much. It's got to be kept close to the ground so we're not aerosolizing and throwing it up in the air. So low trajectory. The bulletin, the way they're designed is, there's two design criteria you have, is the special device approval, which is downloadable off ODH's website. This is their basic design guide for this type of system. And then this document here, OSU Bulletin 912. This is how you design. You use this and that's how you come up with a design, along with manufacturer's instructions and so forth. Bulletin 912 you cannot download. It used to be you could download these things. Now you got to go to the extension office and buy them. So OSU wants to make a few bucks, and that's how they're doing it. You got to buy these now. Here's another thing. When you're looking at application, and we'll touch on this a little bit more later. I'm not getting into all the calculations because there's plenty. But basically, we're going to put down a layer of precipitation that's no more than 0.2 of an inch per day on that site. And that means something in square foot when you get there. Freezing's a big issue. Got to make sure you design against freezing. Draining back, draining on, whatever it might be, you got to protect against freezing of all these components. And I guess I'll mention here, I get asked, and I'm only telling you what I've heard, and that's from Karen Mansell. Many of you know her. Many of you don't like her, but she is who she is. Karen Mansell did studies on this device for this use in the state of Ohio, because Pennsylvania is using it already, and there's various other drier states that use it and warmer states. But the two questions that we had was what will happen to that spray head when it's installed in freezing weather? How will that thing function? So what she tells us she did, and I wasn't there to see it, this is what she tells us. She installed it in a freezer, okay? And then she rotated that spray head like it should be used. And what they found was when it first comes on, yes, there is some frost in the spray mechanism that'll cause it to spray forward in that same location for a short period of time and then begin to warm itself and rotate again. So that's the first thing they did to try to counteract the concern about freezing. Of course, all that water in that upright pipe all gets drained down below grade, but surely there's residual that's left on the spray mechanism. So they did that. Secondly, what happens when there's a foot of snow on the ground and you're spraying it? So they did a runoff study. They put a, I'm going to call it, for lack of a better word, collection gutter at the bottom of the hill where they were spraying this stuff on snow-covered ground. They measured it in areas that had no spray application. They measured in areas that had the spray application and compared to runoff rates. And they were pretty close to the same. So those are the biggest concerns I hear are what about runoff and snow? What about the freezing of the mechanisms? So that's what literature was considered when the state of Ohio approved this device. Yeah, Mike?
We put that spray thing into that farm in Carroll County
Yeah.
last fall.
Yeah.
Last winter, they said that, it was so cold, when they would start spraying, they would go real slow, but then they would, start
Loosen up.
spraying good. But
Okay.
they did say the whole hillside got covered with ice.
Did it? Good sled riding spot. My kids would be right on that.
Only after 6 in the morning.
Yeah. Yeah, after 4 in the morning, you're good to go. They are time dose, and what I mean by time dose, not what you normally think of, those of you who put mounds in, have that 4-hour interval between dosing. This is time dose to put all the effluent out at about 3 or 4 in the morning, so that nobody's out, well, hopefully nobody's outside. So the one we have designed right now on the table runs for about 30 minutes to distribute all that effluent and shuts off. So 4 to 4:30 it's spraying and then it's shut off. So they are time dosed. What about treatment? There's 2 different standards for treatment. They call it restricted and non-restricted access. So let's talk about restricted first. That's this one. This is probably the most common one. You got to be below 200, is it E. coli? Fecal, colony forming units of fecal, yes. 200 fecal or lower for surface application in a restricted area. What does that mean? Private property in the back of the private property is considered restricted application because it's not public access. If you had a golf course, or we have one right now that's being designed, it's in a park. That area is unrestricted because public can walk through it unless you fenced it off. Okay? So then it becomes unrestricted. So those are the treatment levels you have to reach to be able to surface apply that effluent on a property with spray. Also note at the top at number 5, the dose tank is very large. So you'll see there shall be a minimum of 3 times the daily design flow on the dose tank. So that's a pretty large tank. Okay. Another thing, we talked about snow cover, we talked about the freezing concerns, but what about just the application concerns? You can't have ground level and you can't have a spray head sticking out 3 inches out of the ground. What happens when you get the 12 inches of snow? They have to have riser pipes that are anywhere from 18 inches to 36 inches sticking out of the ground to apply the wastewater so you're not covering your nozzles with snow. And that can vary depending upon the area you're in. If you get up in Lake County, they might tell you 48 inches, I don't know. Everything, the piping and so forth has to be color-coded purple. That's like the universal color code for reclaimed wastewater. I know that we've looked at the K-Rain devices and they are color-coded purple. So there already are the piping, perhaps paint, electrical tape, whatever it might need to be to show anybody that is pre-treated wastewater. Yes?
Fittings that are in the ground, I know like some states they require them to be purple also. Are you?
You know what? I don't care what they can't see. So, no, I'm not going to tell you to color code your pipes. Also, signage is required. So you have to have signage indicating that an area is being applied with pretreated wastewater. The control panel also have to have signage saying that this is a pretreated wastewater spray irrigation system.
On all of them that are going in, residential, commercial.
Yeah, all. So if the neighbor's trespassing on your property at 4 a.m., they know.
You can't come back on it.
Yeah. Okay. Vegetation, you have to remove all vegetation within 10 feet that is greater than 10 feet tall. So a 10-foot radius, any vegetation taller than 10 feet has to be removed. Within 5 feet of the spray heads, all woody vegetation has to be. So that means trees, that means probably multiflora rows, those types of things that'll inhibit the application of the wastewater to the surface of the ground. Okay, couple design notes. If you are, once again, what I want you to leave here today is if you think that this is a consideration. I told you earlier about some design things that you need to think about. The application rate is 0.2 inches per day. Well, what does that mean? That means 8.021 square foot per gallon of wastewater per day. So that means that if you have a 3-bedroom home, which we know we estimate at 360 gallons per day, we'll need 2,888 square feet for the application of that wastewater. Okay? So that's, when you are out looking at a site, you're thinking about 50-foot setbacks, you're thinking about, I need 2,800 square foot available in some fashion to apply this wastewater. 4 bedrooms would be 3,800 square foot. When you're laying it out, you want to make sure that all your force mains and your manifolds are taking the most direct route. And I unfortunately don't have any pictures to show you, but what I mean by that is you want equal head from the point when you break it apart. Let's say you have a T and you have 2 going up here and 2 on the other side. You want equal head going to both locations so you have approximately the same application rate. You don't want to go around in series and line up 4 in a row, and that last one's going to have less flow than the first one did. So you got to watch how you're laying it out that way. Also keep in mind that there's a lot of calculations in this manual that go back and forth from PSI to feet ahead, and it can be a pain in the butt. So it has it in the manual, but 1 PSI equals 2.31 feet ahead. You'll have to use that converting back and forth if you're designing. So here's the first design we've had in the county. House, aeration treatment tank, and it's being pumped clear over to this application area. And I'm only going to point out a couple things that are put on a design plan for you to know that they need to be there, among other things. Rain gauges are required in the area of application. They have to, you see the 50-foot setbacks that they've drawn on here, so keep your setback at 50 foot. You see the notes about the 5-foot radius on woody plants removal, then you see the signage, non-potable water signage that goes up. This is just a close-up view of the way they set this up for application. The simplest way to do this, and I'm not going to draw it because she won't get it on the camera, is this is the approximate simple way. Now that's a neat way too, is you'll need 1 spray head per bedroom that sprays a radius of 17 feet and the total diameter of 34 feet. So 34-foot diameter per bedroom. 50-foot setbacks. That's the simplest way to think in your mind. I got to have a circle that's 34 foot wide, 3 of them, and then 50-foot setbacks. Now this gentleman here applied it in a way that you have more like a rectangle shape, and he used the spray head. The spray heads can be set for different angles of application. He did a 90-degree angle for this and a 90-degree angle for that and so forth, instead of using a full 360.
Full circle, I guess.
Pardon me?
I didn't think we were allowed to use full circles.
I don't know why not.
They were worried about runoff and the literature.
It doesn't say anything about not using it. So, well, now if you're going to apply it into a swale, yeah, you can.
Well, yeah, I understand that.
But if it's nothing like that is there. So there are, many of you might be able to see it, they make some suggestions on, there's all sorts of patterns that they lay out here on how you can set these things up to configure the property. So there's another option for you. Okay, so there's a good amount of calculations that have to be done too to create the right situation. But I just want to point out a few things. You see at the top there, he's calculated he needs a 2,800 square feet to apply this wastewater to. I think he was a little high. He actually used 3,217 square feet, which is bigger, that's fine, when he did his calculations. You drop down here, he's figuring all his heads and flow rates. A couple things you'll notice here is, check this out. 12.4 gallons a minute at 146 feet of head. Wow. That's a real low flow rate, but a high friction, high head loss. Now that particular site, there's Big Hill there. So that's part of this problem. Big Hill and smaller diameter pipes. 400 feet. And if you remember from some of our previous classes, the smaller diameter pipe is going to give you more friction. But the flow rate is considerably lower because those spray heads apply at about 3 gallons a minute. So if you have 4 applying at 3 gallons a minute, that's 12 gallons a minute. So many times we're seeing the high head pumps, low flow rate, high head type pumps going in on these. And this page here is once you figure out the flow rate you're after. This is a document from K-Rain. If you get on their website, they have all sorts of variations of, let's see, PSI, operating head, radius of application, and the GPM, the flow rate. So you have Heinz 57 variety of what type of spray head you can use, and you can pick it off. Well, I'm sure there's other manufacturers, but K-Rain was the one we had access to. So once you figure all that out, you have many options for what kind of design you can do and heads you can use. Okay? Then of course you got to pick a pump, just like you've always done. Pick the pump that's going to apply at the head, 146 foot of head desired, and apply it at the right rate. So we need 12, this thing's at 22. What that may create is a situation that applies it because the PSI, the head is a little higher. It probably is going to apply it at several feet longer than the 34 foot that was calculated for this design, 32 feet. So probably at the end of the day, this thing will spray a little farther than what it was intended. Or there may be other ways to eat some head, whichever. Now this thing is also set back, in case that's a concern. You see the 50-foot setback, but they've also coming in 20 or so feet from that, in case we do have a little farther spray. Okay, here's the how they've spec'd out the riser pipe on this job. There's a picture of the spray head, one version of it. You can see here there's different angles for application, setting the different angle, 90, 270, 360, whatever. This is the 4-inch casing pipe with that small diameter pipe that feeds the spray head inside of it, in case somebody gets a little crazy with a lawnmower, whatever, weed whacker. And also we can use that to help to insulate the pipe also. So we've had some discussions about using some spray foam inside of there to try to insulate that pipe a little bit better. This here, air admittance valve. You do have to have means of testing pressure at the head, so you can screw off the air admittance valve, screw on a pressure gauge, check that, put it back in. We want this thing to drain back. That air's got to get back in that device to get all of it drained out of there. We don't want any water sitting in those pipes and causing freezing. A couple other plan notes that have to be put on here. Yeah, it's got to operate properly. This was a statement just to keep us from having water sitting in lines and freezing. Same thing on disturbance. You can't get out there and tear the area up like some homeowners like to do. Just because it's surface and not subsurface, you still can't tear an area up and attempt to use it. There will be some baseline measurements that will get recorded at the end of all of this. Operation and maintenance. I want to make sure I think it's later here too. They are required to have a service contract for the life of this system when you have a spray irrigation system. So that may be a non-selling point to someone who's thinking about this. I think the rest of it, yeah. And there's some language in the design plan that has to be specified, that's spelled out in this the special device approval. It says certain language, you know, reclaimed wastewater, so forth. I think, yeah, here it is. So they got to put certain signage up that states that you're applying wastewater. In fact, the one that's going to be installed soon, this is probably about what it's going to end up looking like. Yeah, you know, it's not in yet, but I've been to the site, and here's your riser pipes, and it's got several trees around it, and that's probably what it's going to end up looking like when it's all said and done. Any questions? Okay. Then here again is the statement that they do need to have a service contract for the life of that system. Spray.
Oh, that's one of them? They would open self-maintain it?
Well, service contract or register as a service provider, that's an option for everybody, any type of system. They'll register and they'll maintain it themselves. That could be an option. Is there any other questions? You're about a half hour early. I hope you don't mind. Any other questions that we can answer?
What makes it a service provider?
Pardon me?
What makes it a service provider? Do we have to be certified through the distributor, the manufacturer of the tank, or through ET?
You have to be. You don't have to be a distributor. No.
I mean, like licensed for the manufacturer.
That looks like that's changed. We're not certain exactly how that's going to play out. Looks like you can get a Class 1 operator license, something like that. Oh, guys, before you leave, pick up your certificate on the way out before you leave. But it could be other options.
Spend hours trying to calculate all this.